Hey everyone, thanks for checking out Greer CPW's social media pages. I'm Alison Rauch, and you know it's getting hot out there, so we're talking dehydration and why it is so important to drink water this time of year. And we've headed out of the office down to Pelham Medical Center with Dr. Stanton, and he's a ER doctor, and thanks so much for letting us come out today. Tell me first off, what exactly is dehydration?
So dehydration really is just when you don't have enough water in your blood. So blood's made up of a bunch of stuff, cells, proteins, but there's the liquid part. And so when you sweat or go to the bathroom or throw up or have diarrhea, all those things, like a lot of the water that's in the blood is what the body uses to flush that stuff out. So when you lose too much of that, you start to have all sorts of effects on your body.
And tell me a little bit about the symptoms and effects of dehydration.
So I think the first symptom people are most aware of and intimately know of is they start to feel thirsty. They start to notice lots of perspiration. They start to notice maybe that their heart rate is going up, that they're feeling hotter. But then other symptoms that they might start to notice is they're breathing faster. They get lightheaded when they change position. They might get a little, people say dizzy, so lightheadedness and difficulty concentrating and just kind of constantly thinking about how hot they are. So those are some of the things you would start noticing when you're dehydrated.
So this time of year, it's been 100 degrees already here in Greer. Have you seen dehydration cases as an ER doctor this year?
Yeah, you see them quite often. I think dehydration plays into a lot of visits to the emergency department. The classic story is been working out in the yard all day, tried to get inside, got very hot, maybe passed out, or just had to sit down, was kind of panting, very hot. But you have a lot of other people, just elderly patients who are in the nursing home. They don't keep up with the amount of water that they need to be drinking or the amount of fluids. People take a lot of different medications that cause them to actually lose water. So blood pressure medications make people urinate more, things like that. But yeah, so I've already had lots of young people to old people. This is not a problem that faces just one age group, and lots of people come in with shortness of breath, headaches, muscle cramps, lightheadedness, passing out.
Okay.
All of those things.
And the thing I've learned is really dehydration can come on pretty fast. And there's a lot of rules out there about what I should drink or how much I should drink in one day. So what would you say to someone who comes into the ER and you say, well, you need to be drinking X amount of glasses a day?
So I did my own Google search for this just to see what people are saying now. But the sort of the common wisdom is if you're at normal level of activity, 8 ounce glasses of water per day. But if you're going to be outside, you need to be drinking more than that per hour. Be very aware of how much time you spend in the sun. So at least have a glass of water every hour. If you're going to be sweating a lot and you're not used to sweating a lot, I would recommend alternating maybe a glass of water, something like Gatorade or some other sport drink, because you really need to replace that salt and sugar that's in your blood too, and helps you rehydrate a lot faster.
Perfect. And where can folks go to get more tips if they want to learn more about dehydration?
So I just, again, quickly kind of searched today and found that DHEC has a very nice webpage about heat exhaustion, heat illness, dehydration, different ways of approaching it individually. And then they link to lots of different sources.
Perfect. Well, you are a wealth of knowledge, and thanks for letting us come out, and hopefully somebody's learned a little something today and can prevent dehydration.
Well, thanks for speaking with us.